Welcome back to the program. You are watching the PM edition of Newsfeed here on News from Africa, channel 405. My name is Oliver Dixon. Now, right now, I want us to take a look at the latest COVID numbers, but not give you headline figures. We'll take a look at the actual patterns in the numbers. We'll have that conversation with Dr. Ridwan Suleiman, who is a mathematician. While cases are increasing while testing has decreased, the test positivity rate is at record high, and interesting trends in provinces are taking place. Increases across the board. Hospitals are, hospital admission cases are rising in KZN and in Gauteng in particular, and that's very worrying. Ridwan, thank you so much for coming on to the show. Really do appreciate it.
Good afternoon, Oliver. Lovely to be with you again.
You and I spoke 7 days ago. What has changed in the last 7 days that we should take note of?
So, Oliver, over the last week, most of the indicators have increased, and most of the indicators are heading towards worrying levels, at least on a national level, and for most provinces too. So we're certainly seeing that the case numbers are increasing, the test positivity rates too, hospital admissions are on the up, and unfortunately, the number of reported deaths are also increasing.
Now let's take a look at the average daily cases per week. That's up 14% in week 53. That's where we are now?
That's correct. So this is the latest up to the end of this week. So the current 7-day average of cases, we're looking at 13,500 cases per day. So that is up 14% compared to this time last week. While the increase does not seem as high as compared to previous weeks, we need to bear in mind that the number of cases is related to the number of tests that are being conducted, because the test positivity rates are so high currently in South Africa, and that's indicated by the color of the bars. So because of the high test positivity rates, the number of cases are certainly an underestimate of the actual number of cases in reality.
Now, let's take a look at who the major contributors are to that average, weekly average. Which provinces at the moment contributes the most over the last 7 days to that average?
So if you look at a provincial level, if we look at the incidence risk, which is the number of daily new cases per 100,000 people in each province, the numbers are still mostly being driven by Western Cape, and increasingly by KwaZulu-Natal and Gauteng. Those are the bigger provinces and are contributing mostly to the high numbers that we're currently seeing. But on top of that, the other provinces are also on the increase too. If you look towards the bottom of the graph, you'll see that all of the other provinces are also on the rise. Of concern is the rapid increase in KwaZulu-Natal, which is surpassed levels that it reported at the peak of its first wave, and currently doubling at about 15 days. Similarly, the rapid increase in the most populous province, that being Gauteng, the numbers are doubling about every 17 or 18 days, at least at the new cases. And also to note is Limpopo, which really didn't see that high levels in the first wave, but currently is looking at numbers that are almost twice as high as what was reported at the peak of its first wave, and increasing also rapidly, up 83% as compared to this time last week, or a doubling time of 8 days for that province.
We can take a look at that graph once again. The Western Cape seems to be on a downward tick right at the top of the graph there, as well as the Eastern Cape. Can we definitively say the Eastern Cape has surpassed their peak and they're now out of the woods, and the picture's starting to look good there? And can we definitively say that the Western Cape may have also surpassed their peak?
So first, Eastern Cape, if we look at this as well as other measures, which is important to also bear in mind, the Eastern Cape has been decreasing or on a sustained decrease for a number of days now by measures of cases, test positivity, hospital admissions, as well as deaths. So we can say that the Eastern Cape has passed its peak. However, if you look closely, we see that the Eastern Cape is sort of starting to hit a bit of a plateau and not continuing downwards. So it's still at very high levels. Also, the test positivity rate is still at very, very high levels. So certainly not out of the woods. And we need to ensure that that decrease continues and continues down towards zero. When we look at the Western Cape, there looks to be a slight decrease over the past few days. However, we need to bear in mind that this may likely be related to a decrease in testing over the festive period. And we can confirm that by looking at the test positivity rate, which has remained really high. In fact, it's increased even further in the Western Cape, now over 40%. So certainly also of concern.
In this week, our test positivity rate is up 23.4%. Where are we now?
So on a national level, the current average of the test positivity is about 32.2%. So this is at a record high, as you mentioned. What it means is that we're finding a positive case for every 3 tests conducted, which is really concerning. And again, it indicates a lot more undetected cases, and that we don't really have an idea of how widespread the infection is. It's certainly an indication of rapid community transmission. Also, we can see this when we zoom in on the different provinces. The test positivity rate is increasing in all provinces. Western Cape, KwaZulu-Natal, Limpopo at all-time record highs, as you can see. And with Western Cape above 40%, and Limpopo increasing quite significantly over the past week, as you can see by the green line on the graph. So these are concerning indications from the test positivity rate.
And when we take a look at the national test positivity rate, you tell us that it is an indication as well of a lot more undetected cases. Is there an estimation of what our undetected cases might be at?
Now, it's very difficult to estimate that. I think one needs to take into account a few factors. We can sort of guess or make an educated guess of the true number of cases, and it's likely 4 to 5 times, possibly now even a bit higher. But like I said, that is a guess, and it's difficult to fully know without having the test to back up that.
We began the year on the 1st of January with more than 18,000 positive cases. Was that a shock to your data set?
Not necessarily, Oliver, and the reason for that is that we normally see, well, firstly, we see a lag over weekends and particularly over the festive period, and a lot of that has been coming through. But even more than that, if we track the trends in the infections, we know that the spread is moving into the populous provinces of KwaZulu-Natal and Gauteng. And with the numbers in these provinces and more densely populated areas, it's no surprise that the numbers are increasing and will continue to increase.
Is it rational to deduce from that we'll have more positive cases on a Monday as opposed to on a Saturday?
Well, what we do know and what we see in the trend is that we'll see a lot more positive or confirmed cases on a Wednesday, and that is because on Monday and Tuesday we sort of see the weekend effects, and from Wednesday we start to see that coming through. So that picks up and carries through for the rest of the week, and we need to bear in mind that, and that's why when we look at all of the measures, we take that into account by looking at 7-day averages, which smooth out those erratic daily numbers.
Before we take a look at other indicators, let's take a look at concentration. How many positive cases per 100,000 people exist nationally, and which provinces have seen an uptick in that indicator?
So I don't have that specific number on hand, so I can't quite comment. But if I can look at the daily incidence numbers, which is the number of new daily cases per 100,000, and the Western Cape is certainly at very high levels, twice as high as the peak of its first wave. KwaZulu-Natal has also surpassed its peak, and Gauteng also rising quite rapidly.
Now, when it comes to the amount of tests done per day, we've seen an almost 8% reduction this particular week. Is there any reason why we saw that reduction that you may have picked up? And what does that mean effectively?
So the primary reason is a decrease in tests over the festive period. We're currently averaging 41,500 tests per day over the last week, and that, as you say, is down 8% as compared to the previous week. And that is expected due to a decrease over the Christmas weekend and over the holidays. And we will most likely see that increase now in the coming week and going forward.
And hospital admissions this week has been up 20%, almost 21% over there. Which provinces are in the red with that?
So the number of new hospital admissions is mostly being driven by very high numbers in the Western Cape. So the new admissions in the Western Cape has increased by 16% as compared to the previous week. We're also seeing very rapid increases in KwaZulu-Natal, which has increased by 27% as compared to last week. And Gauteng has increased by 44% as compared to this time last week.
Shockingly, we've seen 34% more deaths this week than the previous week, which is also our all-time high. It shoots up on that graph of the average daily COVID-19 deaths per week. That is a very scary picture. What happened over there? What did we pick up this week that we didn't pick up, that we didn't do last week? Are hospitals not attending to staff adequately anymore? What's changed?
Look, this particular figure has moved up quite rapidly and a bit surprisingly quicker than I would have expected, to be quite honest. We're currently reporting 375 deaths per day. That's an average over the past week. And that's an increase of 34% compared to last week, or a doubling time of 15 days. I've not specifically seen reports of overwhelmed hospitals per se, although we do know that many hospitals are at capacity and many healthcare workers are working overtime to try and support those in hospital. We may also need to bear in mind that this number could be related to reporting that is being done. So it could be just that the deaths are being reported more timelessly, or we may be attributing more deaths directly to COVID-19. It's difficult to fully understand the reasons behind this. If we zoom in on a provincial level, we'll see that this number is again mostly being driven by high number of daily deaths in the Eastern Cape as well as in Western Cape. Both those are higher than what was reported at the peak of their first waves. And we're also seeing rapid increase in the number of deaths in KwaZulu-Natal and Gauteng. Those particular provinces, the number of deaths are doubling 8 days and 5.5 days respectively.
Now we're 1 week into the new level 3 lockdown. How long does it typically take for the effects of a new lockdown level to be seen in the numbers? So that's to say, how long should we expect to wait before we can see the effects of level lockdown 3 take place?
Look, because of the lag time, because of the time it takes for someone who has been infected to start showing symptoms, to get tested, to get those results to come through, generally we only start seeing the effects of interventions 10 days or 2 weeks at least after those interventions are put in place. So certainly a bit too soon to see any of the effects of those interventions. I think we need to wait another week before we start seeing that.
And are there any indicators that you expect to see a rapid shift in over the next week? And which are those?
Well, we'll continue to see a high number of confirmed cases, particularly as the infection spreads in KwaZulu-Natal and Gauteng. So we do expect that those numbers will continue to increase, bearing in mind that those are restricted by testing capacity constraints and testing criteria. So if cases don't necessarily increase per se, we'll see that the measure of test positivity will then compensate for that and increase further. That's a leading indicator. Hospitalizations and death numbers are lagging indicators. So we're still seeing very high death numbers in Eastern Cape and Western Cape. And we'll start to see those or we'll continue to see those picking up in KwaZulu-Natal and Gauteng following the increase in cases.
Dr. Ridwan Suleiman, thank you so much for your time. Really do appreciate it.
Thank you so much for having me, Oliver.
That is statistician, researcher, and mathematician Dr. Ridwan Suleiman.